All right, thank you for joining us today for our media availability. We'll go ahead, we'll start with a brief presentation and then we'll do a Q&A at the end. So please hold your questions until the end. And today with us, we have Dr. Rachel Hurley, State Epidemiologist for CDPHE, Scott Bookman, COVID-19 Instant Commander, and Sarah Thunberg, Special COVID-19 Advisor for CDPHE. And I am Heidi Bosk, and I will be your moderator today. We also have ASL, and so if you want to adjust your screen, we have videos pinned, but if you need to adjust your screen in any way, please do so. And with that, I'm going to turn it over to Dr. Hurley.
Great. Thank you so much, Heidi. Good morning, everyone. As COVID-19 cases rise in Colorado and the US, we wanted to take this opportunity to give you an update on the data. Cases are increasing at a rapid pace. Right now, about 1 in 110 Coloradans are currently contagious with COVID-19. And we know that in some regions or counties of the state, that is as low as 1 in 50 or 1 in 60. So that level of disease is particularly challenging because we know that a large proportion of those infections are among asymptomatic people who are potentially spreading the infection without knowing that they even have it. So this figure shows you our 7-day average of case counts over time. You can see that we've had three waves of illness, a spring wave, a July wave, and now a fall wave of illness. And at this point, we are at our highest case counts since the beginning of the pandemic. In the last week, 4,000 cases per day have occurred on a daily basis in the state. And that's really about double what we were seeing about 2 weeks ago. Looking at this figure, if you look back to the left, you'll see that case counts looks really much lower in the spring. And that's really because we had much less testing available and we weren't identifying as many cases. But Colorado has worked really hard to increase our testing capacity to capture more cases so that people who test positive and their contacts can take action to prevent further spread of the infection. So we want everyone who needs a test to get a test. We advise that if you've been exposed to COVID-19 but don't have symptoms, get tested 7 days after your exposure and quarantine for a full 14 days, regardless of the test result. If you have symptoms of COVID-19, get tested immediately. Next slide. This next figure shows you the percentage of our tests that come back positive in the state. And this is how we really check that when we're seeing more testing being done in the state, that that testing really represents a true increase in the amount of infections that are occurring. So when we see the percent positivity value increase as we're doing more testing like we are right now, and we see that value increasing in this figure here. You can see that that number has consistently gone up from week to week as we've increased the amount of testing that we're doing in the state. That means that the amount of disease that's occurring in the state is also increasing and increasing rapidly. Next slide. We're also having a rapid rise in COVID-19 hospitalizations in the state with mounting pressure on our healthcare system. This figure shows you daily hospitalization counts in the state. Again, you can see the 3 waves of illness reflected in the hospitalization data. If you look at the far right and today's data point, you'll see that we're at our highest point of hospitalization since the beginning of the pandemic. Unfortunately, if this trend continues, we risk exceeding our healthcare capacity. And this is really why it's so urgent right now for Coloradans to follow public health recommendations about COVID-19. Next slide.
Great, and with that, we're going to take it over to Scott Bookman.
Thank you. Good morning, everyone. First, I want to take a moment to thank all of the frontline healthcare workers and first responders in Colorado who have been working on the front line since the beginning of this pandemic to care for all Coloradans who have become sick with COVID. As Dr. Hurley mentioned, we are at the highest point in hospitalizations in the course of this pandemic. In April, we peaked at 888 simultaneously hospitalized people in Colorado. Today, we're at over more than 1,400. Our healthcare system is beginning to feel the stress, and we are urging all Coloradans to take all of the efforts necessary to stop this trend from continuing. At the Unified Coordination Center, at the State Emergency Operations Center, we are working hard to prepare to support our healthcare facilities as this surge continues. We are working with the Colorado Hospital Association to operationalize and implement the Colorado Hospital Transfer Collaborative. This is an effort amongst all hospitals in Colorado to ensure that we can move patients from areas of high density to areas of lower density to ensure that we are utilizing every hospital bed in the state as they are needed. This will be augmented by the Interagency Interfacility Transport Center, which again is a collaborative effort between the state, the hospital association, and then our EMS partners to ensure that we have enough EMS resources to efficiently move patients where they need to be when they need to be moved. We're also hearing from our hospitals that they are seeing more staff members sick with COVID in the last month than they have seen in the totality of this pandemic. This is creating serious staffing problems for our hospitals and exacerbating the stress that they are feeling. So to mitigate that, the state EOC has activated our medical staffing contracts to ensure that we can supplement hospitals and other healthcare facilities with critically needed staff when necessary. The picture on this slide is of our field hospital at the Convention Center in Denver. This is one of our alternate care sites. Our goal is to never have to put a patient into one of these sites because we've been able to protect the capacity of our normal healthcare system. That being said, we have established these sites and we are prepared to open them if needed. We are continuing to evaluate the data on a daily basis so that we are prepared to activate when needed. And go to the next slide. So given this stress on the healthcare system and given the critical importance of making sure that we don't move to a point where we have to enact crisis standards of care in our hospitals, we are asking Coloradans to do 3 absolutely important things during the month of November. First, interact only with those in your household. We understand how difficult that can be. Certainly as we move into the holiday season, we understand how difficult that can be. But we all need to work together right now to avoid any social interactions with those who live outside of our home. Second, we need to keep our distance. Just because you're wearing a mask doesn't mean you aren't at risk of interacting with others in close proximity. We have to get back to that social distancing and keeping more than 6 feet away from others to ensure that we stop the spread of this disease. And finally, we need to wear a mask. The evidence is clear that if you wear a mask, you have a much lower risk of getting the virus or transmitting it to others. These 3 things are absolutely critical to stopping this wave and ensuring that our healthcare system is not overwhelmed. I'm now going to turn it over to my colleague, Sarah Thunberg, who will talk more about another critical intervention that all Coloradans should do.
Thanks, Scott. As my colleague said, positive cases continue to rise in Colorado. So it's ever more important that we use every single tool in our toolbox to fight the disease. So today we're talking about an update to one of those key tools, Colorado exposure notifications. We're going to talk about new numbers as well as some process improvements. A reminder, Colorado exposure notifications is a privacy-forward opt-in service that allows people to notify others who they might have been in close proximity with after they test positive for COVID. It's an anonymous service that augments all of our other public health interventions, and we need everybody to add their phone to the fight. Next slide, please. As Governor Polis announced last week, we're so proud and excited that more than 1 million Coloradans have enabled Colorado exposure notifications on their smartphones. Next slide, please. Studies show that if just 15% of any community can enable exposure notifications, infections can be reduced by up to 8% and fatalities by up to 6%. We're now at 17% adoption in Colorado, which is outstanding and huge. But as adoption increases, so does the utility of this technology. So if you have not added your phone to the fight against COVID, please go to addyourphone.com and do it today, like right now, please. So for the million people who've opted in already, please call your loved ones, call your friends, your colleagues, your book club that you're doing remotely now, and encourage them to add their phones today. Tell them why you did it. Tell them why they should do it. Next slide, please. We've also heard from everybody, or lots of you, who've enabled exposure notifications that you struggled to get the keys to unlock the notification after you had tested positive. And we've made huge process improvements to streamline that process and make it easier for everybody. Initially, we set up the system so that local public health agencies provided the exposure notification verification codes over the phone or via text message as part of our traditional case investigation and contact tracing process. But we recognized that as cases increased, we couldn't get those codes out fast enough. So we've created a new system where any positive or probable COVID test result, as it enters our disease reporting system, which is always done, we will automatically send a text message which enables individuals to activate their one-time verification code and send the message to the contacts they've come in contact with that they have potentially been exposed. So we've really automated this, and people should be getting notifications much more quickly. We're excited about this because this gets Coloradans the information they need very quickly without overwhelming our public health workers, our public health agencies, and other health workers. It's a big win for Colorado. Next slide, please. We've already seen this process improve the experience for Coloradans using exposure notifications. In the early days after launch, you'll see on the left side of this slide, we were able to issue between 20 and 40 sets of keys each day. And since we've automated this process, we're now issuing between 3,000 and 5,000 each day. Next slide, please. And out of that, we are able to see that about 3,400 Coloradans have shared their positive test results with those they've come in close contact with. Next slide, please. We're learning from this experience and expanding other automations to try to support Coloradans in taking protective actions against COVID. So starting today, in addition to automating the code distribution for exposure notification, those text messages will also include information about how to isolate, how to conduct their own contact notification. So how to call all of the people you might have come in contact with and let them know that they might have been exposed, and other really key infection prevention strategies. So we continue to expand, we continue to grow, automate, and really rise to this challenge. We ask again that you wear your mask, you keep your distance, you quarantine and isolate as directed, avoid social gatherings, wash your hands, and lastly, add your phone to the fight against COVID. We can continue to do this together, and we will only get out of this together. Next slide. So please add your phone to the fight. And I think that's it for me.
Wonderful. Thank you all so much. Now we'll go ahead and take it over to our Q&A portion of the presentation. And to do this, we'll use the raise hand function. I will call on you. And if you could say your name and the outlet that you're with, that would be wonderful. And Vinny, I will start with you.
Thank you. Good morning. This is Vinny Del Giudice at Bloomberg News and Question in Denver. Two questions regarding seniors. Number one, how grim is the outlook this time around for nursing homes? They're probably better prepared, but still, what is the situation? What is the outlook? Number two, on seniors, regarding isolation, people at home, and restrictions on socializing. What advice do you give to people that want to drop off an apple pie at grandmother's house, for example, for Thanksgiving? Thank you very much.
Yeah, this is Rachel. I can take that question. Others can elaborate as they'd like. So, so I'd say that we've come a long way with nursing homes and other long-term care facilities. I think there have been lots of really important changes that have been made and a lot that has been learned in the last few months. Some of those key changes include strategies around infection prevention and cohorting to make sure that seniors living in facilities are protected. We also have really robust testing programs that have been established in these facilities to ensure that cases are identified early, whether those are cases among workers at facilities or residents of those facilities. And so that outbreaks that occur can be controlled quite quickly. And we've really seen that in our data. If you look at outbreak data over time, one of the things that we have seen is that the overall size of those outbreaks when they occur have really on average gotten much smaller, meaning that we're finding those outbreaks sooner, and that's largely through the testing strategies that are in place, intervening sooner so that fewer cases are occurring in those facilities. But the reality is that seniors continue to be highly vulnerable to this infection. We know that age independent of chronic disease is a risk factor for severe outcomes due to COVID. And so it's why it's really important for all of us, whether we are taking care of seniors in residential care facilities, or we have family members that are living in the community, to really all do our part to make sure that seniors in Colorado are protected from infection in the state. So I think they continue to be vulnerable, but lots of great strides being made in our residential facilities at this point. To your second question, in general, we know that contaminated surfaces, whether that's a plastic bag or a box or a food item, those are ways that COVID-19 can be transmitted from person to person, but we know in general that really being in close contact with someone within 6 feet is really the primary route of disease transmission. And so I would think that exchanging food, as long as it's done in a way where face-to-face contact is not made, it would be a lower risk activity compared to gathering. So I think it would be a good alternative to gathering as a family together, to instead drop off grandma's favorite recipe on her front porch and exchange perhaps favorite Thanksgiving side dishes that way instead of gathering together in person.
Great, thank you. And before we go to the next question, I believe, Scott, you had an update.
Yes, I just want to make one quick clarification. Our staffing contracts have been activated, not for our alternate care sites. Our staffing contracts have been activated to support other healthcare facilities as they face staffing challenge.
Great, okay. Vicente, I'm going to take it over to you. And if you could say which outlet you're with.
Yes, good morning. Thank you. My name is Vicente Arenas, and I'm with Fox 31 KDVR. Much has been said about the challenges that are being faced in contact tracing. How is this notification service helping? Is it helping achieve that? Because we keep hearing we can't keep up with the demand to contact all the people who may be COVID positive. Is this helping?
Yeah, absolutely. So I think this is, again, another tool in the toolbox. It doesn't replace traditional contact tracing or case investigation. It's a different and adjacent sort of tool or service. And what it allows us to do and allows individuals to do is anonymously notify individuals that they might not even know that they've been in close proximity to somebody who's tested positive for COVID. So one of the great examples I think I've heard is that somebody ended up running into an old high school friend in line at the grocery store, and they stepped out of line and ended up talking for 15 or 20 minutes and then went about their business. They didn't exchange phone numbers. They didn't know how to find each other again. But then one of those individuals subsequently tested positive for COVID. And they were able to use their exposure notification to alert everyone they came in contact with anonymously that they had been in close proximity, and they were able to reconnect after the fact. And the other side of that conversation said, oh, I got that exposure notification, and I wondered if it was from you. Are you feeling okay? Are you well? So that's a time when the service has been anonymized because people chose to have that conversation. But it's really about being able to notify people who you might not know, the people you sit next to for a long time on transportation, or who you sit with in the doctor's office waiting room. I don't know, hopefully people aren't doing that. But it's just another tool, a real augmentation. And so we would ask everybody to use it.
Great, thank you. Jessica, I'm going to take it to you, and if you could say which outlet you're with.
Oh, hi, it's Jessica with the Post. Scott, you answered one of my questions, but I wanted to see if you could explain a little bit more about how that medical staffing contracts are working, particularly with where the workers are coming from, given there's the shortage of staffing. We're hearing there's the shortage kind of nationwide. And so I don't know how that's affecting the state's ability to pull in more nurses and doctors for the hospitals. And also, are we at a point where hospitals are having staff who test positive still treat patients like we're hearing in Utah?
I will work backwards. At this point, we are not having Colorado staff who test positive work in the hospitals like they are in other states. While we see increasing staff shortages, we have not reached that point yet. We have a number of different staffing contracts in place. We are in constant communication with those contractors to assess the availability of staffing. We are also using the Colorado Volunteer Mobilizer to access staff who maybe aren't in the workforce anymore, but who would like to volunteer to support our efforts.
Great, thank you. Chris, I'm going to take it over to you, and if you could say which outlet that you're with.
Chris Vanderveen with 9 News. I have 2 questions. First question is, it appears as if it took 2 weeks for CDPHE to sort of fully realize that the notification system wasn't working very efficiently. In fact, it was barely working at all. You were getting maybe a dozen or so of those codes sent to positive patients. Why did it take so long for that problem to be addressed and remedied? And the other question is, the rollout of the new color system yesterday has carried with it a lot of confusion. And it seems as if as late as yesterday morning, there were still fixes that were being made to it. Was it rushed through? You still don't even have that color system addressed on your website yet. Was this rushed through in any way?
I'll take both of those. So I think there's a common theme in the answer to both of those questions, which is we're in the middle of a global pandemic where cases are rising incredibly rapidly, and we are all moving as fast as possible, iterating as quickly as possible to have the best of everything we can in the conditions. So on exposure notification, we recognized very, very early that the system we had hoped was going to work wasn't. And we began working on building a whole new technology solution to automate that. And so I think as somebody who comes from the startup technology world, less than 2 weeks from problem solved to new technology in the field is a pretty good outcome. And I feel really confident about it. I wish we could go faster, but building new technology is hard. And we also wanted to make sure we got it right. We didn't compromise any privacy. We didn't compromise any of the things we'd committed to Coloradans on exposure notifications. And this was a way we could do it. And so we did small pilots, as you do, to make sure it doesn't break. And then it really is working. So I think that is as fast as we could go. And I'm really proud of the work the team did. And we continue to iterate, and we'll continue to build additional great features and services, like today's announcement that we're going to include isolation instructions along with the information about the keys. On the dial and other things related to that, I think this is another example of rapid learning and wanting to be as transparent and as forthcoming as possible, and working really closely in collaboration with our local public health agency partners. And so we are giving the information out as fast as we have it and as soon as we know it. And sometimes it takes a little longer to get things on the website. And we ask for grace and collaboration and partnership. We are all in this together, and we are all doing the best we can.
Great. Okay, I will take it over to Ray, and if you could say which outlet that you're with.
Hi, Ray Ellen Bichelle with Kaiser Health News. I was hoping, Scott Bookman, you could talk a little bit more about the this coordinating of transferring patients, how that, just sort of the mechanics of how that is expected to be more efficient than the current way that transfers are arranged. And related to that, what would be the point at which Colorado might draw sort of state lines and say, we're no longer accepting patients from Wyoming or Utah or any other state?
So our healthcare system in Colorado is already very sophisticated, and our large healthcare systems have transfer centers that allow them to move patients within their own systems and to bring people into their hospitals from outside. And so what we have done in collaboration with the Hospital Association is bring all of those transfer centers together to work collaboratively to make sure that we are using every available bed, regardless of what system a patient would normally be seen at, regardless of insurance payer, to ensure that we are using all the beds available to us. Our hospitals on a daily basis before COVID would see patients transferred in from out of state. We have a lot of tertiary care hospitals in Colorado that serve many of our surrounding states. Our hospitals are working diligently every day to ensure that they are maintaining the best levels of capacity, and that does involve deciding whether or not to accept out-of-state transfers.
Great, thank you. John, I'm going to take it over to you, and if you could say which outlet that you're with.
Great, thanks. Hi, everybody. It's John Ingold from the Colorado Sun. I have two follow-ups to Chris's question. First of all is on the decision to redefine the red level in the dial and create this new purple level that has sort of a higher bar for when counties would be moved into a full stay-at-home order. I'm wondering, where did that idea come from? Is that an idea that came out of CDPHE and the public health professionals working on the pandemic, or is that an idea that came from somewhere else? And then my second question is on the exposure notifications. Sarah, you showed a slide that showed 3,000 to 5,000 keys being sent out per day, but if I'm understanding correctly, only about 3,400 people have actually sent those notifications. And so I'm wondering what's the gap between there? Why is there a gap between lots of people receiving keys, but not a lot of people actually following through and sending out the notifications?
Sure, absolutely. So let's start with exposure notifications. So there's two reasons why, primarily. The first one is that we send text messages to everybody who tests positive, no matter if they have exposure notifications enabled or not. So currently, about 17% of Colorado's residents have exposure notifications enabled. So we're sending more keys, one-time use codes, to people than actually have the service. But that 3,500 is tracking very similarly to the 17% adoption we see. So it's really about numbers. We're over sending so that we don't lose the opportunity, but just we're seeing people who have enabled the service utilize those keys aligned with what we expected. On the dial, all of the work on the dial is in collaboration with our partners. It's CDPHE, it's the governor's office, it's the local public health agencies, it's the entities that support those. It's really worked in collaboration.
Great, thank you. Oh, Scott. John, did you have one more thing to add? Sorry.
I just said thank you.
Oh, okay, great. Thank you. Scott, I'm going to take it over to you, and if you could say which outlet that you're with.
Hey, good morning. This is Scott Franz with KUNC. I have a question for Dr. Herlihy. I'm wondering if you could briefly talk about the impact of a community spread event. Specifically, if there is community spread, can that lead to more coronavirus cases at nursing homes? Is there a correlation? And if there is, do you have any examples of that?
Thank you. That's a good question. So we do in general see that outbreaks in all settings really track with community level transmission. And that includes long-term care facilities as well. So as we see community level rates go up, we see, I think, more opportunities for the virus to potentially be introduced into settings like nursing homes or other long-term care facilities or residential facilities. And the risk there is primarily through staff who may be exposed in the community and then unknowingly, because oftentimes this infection unfortunately is asymptomatic, so we don't have any signs to know to stay home. Those workers could potentially introduce that virus into a facility. And so that is an example that we have seen where on multiple occasions we have seen the index case, the first case associated with an outbreak, be staff members who work in a facility.
Great, thank you. Marshall, I'm going to take it over to you, and if you could say which outlet that you're with.
Hey, it's Marshall Zellinger at 9 News. Forgive me for taking advantage of being able to ask multiple questions. I'm kind of the frequently asked questions guy today about the new restrictions and where certain things fall under the new dial. So whoever can answer, where do ski resorts fall? What category are ski resorts, and are they limited right now? Are grocery stores and big box stores considered the critical and non-critical retail line, which means grocery stores, Targets, Home Depots would have to be 50% under level red? And where do the Broncos fall under all this? Will their variants be reconsidered? Oh, and one last thing, the restaurants that built outdoor venues that are enclosed, but for one family, are those still restricted in level red?
So Marshall, I think because yours are so multi-level and appreciated, I think we'll go ahead and take these over to the media info line to get you some specifics. And so if you want to shoot those over to media_info at state.co.us, then we can address all of those.
Well, okay, let me ask one about enforcement. If when I get the answers to those about, well, let's say ski resorts are limited, grocery stores are limited again, how does the enforcement work on that today versus back in March and April?
So enforcement remains a challenge, and we work with our county partners on the best strategies to enforce. We collaborate with the counties around movement on the dial, but once that movement occurs, it really is the counties that are expected to enact and enforce those restrictions. And we, again, work in partnership. And more than relying on enforcement, we ask individuals to participate with us in meeting those restrictions. They're not meant to be punitive or anything like that. It really is to save lives. And so rather than moving towards, well, how are you going to enforce this? We ask that people comply, and we ask that people work with their county and with the state on these restrictions and on these changes.
Great, thank you. Alice, I'm going to take it over to you, and if you could say which outlet that you're with.
Hi, yeah, this is Ellis Arnold with Colorado Community Media. Thanks for taking our questions today. I've got two questions here. Douglas County has said it would revisit its metrics the week of December 18th to consider additional restrictions. So the first question is CDPHE giving counties a month-long period to attempt to reverse their trends before moving them to level purple, potentially the stay-at-home orders? And then the second question is, should we expect the 15 counties that are moving to level red on Friday to be moved to stay-at-home orders in 2 weeks or in a month if their metrics don't start to reverse from where they are now?
I'll start, and then maybe Scott, if you have additional to answer. I think on all of these cases, we are working really closely with our local public health agency partners. And if we talk to them daily usually, and are working in collaboration and making decisions about what's best for the community and the state overall.
And Alice, I can hop in. We'll, on the media info side, we can go ahead and get you a bit more information in detail if you want to shoot your question over to media_info@state.co.us. And I believe, Michael, I'm going to take it over to you. And if you could say which outlet that you're with.
Hi, everyone. Michael Gutman, KRFC Public Radio in Fort Collins. My question lends itself to behavior. And I think much of the science and recommendations feels manageable for the individual. But when we enter into group dynamics, that becomes much more difficult. I'm wondering if there's any plans to partner with the social scientists or behavioral psychologists to understand what group dynamics look like so that we can be better equipped with our rhetoric to talk with our neighbors and our community members to enforce that we are all in this together. Thank you.
Yeah, this is Rachel. I can take that. I think you're absolutely right that, when we look at public health interventions, they are population level interventions. They obviously rely on individual behavior change, but you're right that there are elements of human behavior, of psychology, of personal decision making associated with these recommendations, and certainly taking into consideration, making sure that we are sharing information in an appropriate way, sharing the information with people that allows them to make those personal decisions is really an important part of public health work in general, not just around COVID-19 response, but in general around public health messaging that we do routinely in the state. So that's absolutely a critical part of what we do in our work on a daily basis.
Great, thank you. Seth, I'm going to take it to you, and if you could say which outlet that you're with.
Hi, guys. This is Seth Klayman with the Denver Gazette. Following up on the question earlier about the staffing contracts, can you elaborate a bit about which companies you signed the contracts with? Activated the contracts with. How many staffers are going to be brought in and into which facilities? Thank you.
So I would ask that for the details you follow up with the media info line. We are continuing to evaluate the need on a daily basis as we interact with all of our partners in this response. And as we get more information from them and as the need is better defined, we can react from there.
Great, thank you. Noel, I'm going to take it over to you, and if you could say which outlet you're with.
Yes, hi, this is Noel Brennan with 9 News. Bringing it back to the Broncos question, our newsroom continues to get questions about the 5,700 people allowed at the stadium. And with Denver moving to level red on Friday, what is the status of that variance, and is it going to be reconsidered? Thanks.
So the Broncos have been wonderful partners throughout the course of this pandemic. We continue to be in conversations with the Broncos to make sure that we are doing all that we can to keep everyone safe.
Great, thank you. John, I'm going to take it over to you, and if you could say which outlet that you're with. John Daly, can you hear us?
Can you hear?
Yeah, go for it.
Okay, sorry about that. I apologize. Yeah, John Daly, Colorado Public Radio. Question about holiday travel. I know you're advising people to not travel, but there are a lot of people who will. I wonder if you could assess or talk a little bit about the risks of travel, in particular to and through the airport. We have a TSA agent from DIA that died of COVID. We heard about that just the last day or so here. Can you just talk about what you'd advise for people regarding travel?
This is Rachel. I can take that question. So we would strongly recommend that individuals reconsider their travel plans at this point. Traveling during a pandemic, especially right now, while our disease transmission rates are so high, is a pretty high risk activity. As I mentioned earlier, 1 in 110 Coloradans are currently infectious with COVID-19. And in some metropolitan areas or regions of the state, we know that that's approximately 1 in 50 or 1 in 60. And during the course of travel, so whether that's, you're taking a train, you're taking a bus, or you're taking an airplane, you are going to run into many more people than that. And your chances of being exposed to COVID-19 and potentially bringing the virus with you to your loved ones is quite high. So again, recommendation would be to reconsider travel plans and consider both, the folks that you're going to visit and the risk to them, as well as your personal safety when you think about the upcoming holidays.
Great, thank you. And I'm going to take one more question. And if we did not get to your question, please send those over to media_info@state.co.us, and we will work on getting you some answers. And Megan, I'm going to take it to you, if you can say which outlet that you're with.
Hi there, my name is Megan. I'm from KKTV. This is kind of piggybacking off of the Thanksgiving travel. I've been seeing some places where people are kind of saying, oh, I have a negative COVID test result. I can still go to Thanksgiving with my family. Can you maybe just talk about how that's probably not enough? Just for people who are kind of trying to almost find a loophole to be able to gather still in bigger groups, if that makes sense.
Yes, and I appreciate that you mentioned the term loophole, because this really shouldn't be about finding loopholes. It should really be about protecting yourself, your family, and our community right now. And so we know that there are limitations, significant limitations with tests when they're used for that type of purpose. We know that a test result is really just a snapshot. So if you have a test result done today, that means you are negative today. It does not mean that you are negative tomorrow or the day that you get your test result back. It's particularly risky if individuals continue to have exposures after they are tested. We also know that tests are not perfect, and we've seen examples of this where individuals have a negative test result and it ends up being a false negative result. And because of that, they potentially go on to expose other individuals. And it's particularly challenging with COVID-19 compared to other infectious diseases, because potentially 40% of individuals who are infected with this virus are asymptomatic. And so we don't have those additional flu symptoms that really keep us home and let us know that we're infected. And so I'd say that, testing is a sole strategy ahead of holidays is really a pretty risky strategy.
Thank you.
Great, thank you. And I want to, I guess, any final thoughts or words from our participants today before I send you all on your merry way?
Add your phone to the fight. Go to addyourphone.com. And remember that, just as Dr. Hurley said, none of these strategies alone can do it. We all have to do all of them to the best of our ability. So wear a mask, stay apart, be with your household only, enable exposure notifications, and just stay home and be well.
Great, thank you. So thank you, Dr. Hurley, Scott Bookman, Sarah Thunberg. And if you have any questions that we didn't get a chance to answer, please send them to media_info@state.co.us. And I hope you all have a safe and nice afternoon. Thank you.